Welcome to the Bladder Cancer Canada podcast, Bladder Cancer Matters. I'm your host, Summer Stewart, volunteer with Bladder Cancer Canada. As the first and only Canadian patient advocacy organization dedicated to bladder cancer issues, Bladder Cancer Canada is proud to provide patients, their caregivers, and families with the support and resources they need to help navigate a bladder cancer diagnosis. Through patient support, awareness, and research, our vision is to create a world where bladder cancer is just a memory. While Bladder Cancer Canada strives to support Canadians in their diagnosis and journey, we hope that anyone listening from around the world can benefit from these discussions and know we support you too. As a reminder, this podcast is for educational purposes only and is not intended for medical advice. If you need medical information, please speak to your physician. May is Bladder Cancer Awareness Month, so we've invited a guest who has a unique experience. This is Krysta's story, Turning Lemons into Lemonade, where we welcome bladder cancer survivor Krysta Brkich from Vancouver, BC, to share her unique story.
Thank you for having me, Summer. I really appreciate it.
Oh, wonderful. Maybe if you could tell us a little about yourself and your pre-diagnosis life.
Sure. So I am 39. When I was diagnosed, I was 37. And the life before that, I'm actually a dual citizen of Canada and US. So born and raised in the States, married a Canadian, came up to Canada in 2015, had a life with him for a while. When that ended, I decided to stay because Canada was my home. I love it here. I'm based right outside of Vancouver, so I've got the benefit of the mountains and the sea right near me. So I'm very much an outdoors person, hiking, kayaking, and all that. Before bladder cancer, was a lot different. I didn't care for myself as much as I do now. So, but yeah, Canada has been amazing to me, and it's a place that I call home.
That is such a young age to get a diagnosis at 37. How alarming. Maybe you can walk me through the first signs and symptoms and what led you to seek the medical attention and eventually discover that you had bladder cancer.
It is alarming at 37. That is definitely not, when my symptoms started, that is definitely not even a thought that crossed my mind that it would be bladder cancer, ever. I was 37 and when I was diagnosed, so I was 36 when my symptoms started. And they started in August of 2021. I had taken a week off of work to have kind of a staycation because that was the end of COVID time. So we weren't really allowed to go anywhere. And I was just going to have a staycation with friends and do local things and go hiking and shopping. And it was a Saturday, and I was like, I'm going to take myself out for dinner. I'm single. I'm confident to go out to dinner alone. So I thought, okay, I'm going to get all dolled up and go out to dinner. And I got dressed up, went to use the washroom before I left the house, and there was blood in the toilet. And I just kind of sat there in a little bit of shock. And then everything ran through my mind. I'm like, oh, is this menstrual? Like, this can't be menstrual because it just didn't make sense at the time. Definitely wasn't. And then everything goes through your mind. Like, what is this?
Yeah.
So it's 7 p.m. on a Saturday. There's no clinics open. There's no walk-ins open. There's no doctor's offices open. So I get onto Google walk-in clinic, and I find one that's about 25 minutes away, and I drive to it, and they're closed. So the Google was wrong. And across the street, ironically enough, was the hospital. I sat in my car and I thought, oh man, am I going to go sit in an emergency room and figure out what this is? But I could sit there for 6 hours and they could tell me, we can't help you in the emergency room. You have to see your physician. So I texted a girlfriend who is a nurse, and she worked in urology for a long time. So I told her what was going on, and my symptoms is just blood. And there was no other symptoms other than the blood. I am a woman, obviously. Many of us have had UTIs. We know what that feels like when we have a UTI, the stinging, the burning, the urgency to go. There is sometimes blood involved. I've had UTIs where there is blood, but I had no other symptoms at this time other than the blood. And so I knew already that it wasn't a UTI. So when I called her, I said, what do you suggest I do? She said, talk to your doctor in the morning, just go home. Like, if you're not in pain, don't go waste your evening sitting in an emergency room. go home, drink a bunch of fluids, call your doctor first thing in the morning. And so that's what I did.
And you've got a family physician, do you?
I am lucky enough to have a family physician, yes. If I wasn't, I would be sitting at a walk-in clinic going through the same thing.
Right.
So, when I was passing my urine, there was blood clots. It wasn't just blood. There was like a pinch. And I thought, oh my gosh, could this be like a kidney stone? Because I've heard people having kidney stones, having a pinch when the urine. And so, I described that to my doctor. Oh, she had me do a culture of my urine. And she's like, she's like, I don't see any infection in your urine. So why don't I send you in for an x-ray of your pelvis so we can see if there is any stones within your bladder or your kidneys. We can see if there's any there. And if there isn't, maybe it could have been, but it's hard to say. So that was our first step, was to get an x-ray done.
Mm-hmm.
And that came back nothing in a few days. And she said, if this comes up again, let me know. So a month later, there was no blood for like a month. I thought, okay, this is okay. And then suddenly there was blood again. Same thing, clots, blood. I called her up. I'm like, okay, it's back. So she sends me in for an ultrasound at this point. And that's when they found, which they called the mass. And when you hear you have a mass in your bladder, your whole world just stops. My doctor is incredible. She is absolutely amazing. She did not stop researching this with me, because what I have found and what I've heard in a lot of support groups is women get put on antibiotics for bladder infections or UTIs. Nothing against the doctors, but it is very commonly mistaken for an infection or a UTI. So she just thought, this isn't right, and I don't want to just put you on antibiotics to put you on antibiotics. So she's wonderful, because she knows I suffer from anxiety, and I would rather know the information over the phone. I don't need to be sat down in an office and told face to face. Like, I need to know things. If you know, I need to know. So she called me at work, which probably wasn't the best place to tell me this, but she said, you have a mass in your bladder. So we're going to send you for some additional tests and which we call a cystoscopy, where they take a camera and go inside of your bladder to look.
So what was your initial thoughts on that?
Well, they don't tell you at the time how big this mass is. So it's like, mass, like, is this 6 inches? Is this 2 inches? Is it a centimeter? Like, how big is the mass? Like, in your brain, you think mass, you immediately go down the worst case scenario. This is cancer. This is, I'm going to die. Like, I'm 37 now, and my life has kind of just started again. And you run through all of these what ifs. I can't believe this is happening. How do I tell my family? So it was absolutely terrifying.
You were speaking about going through additional tests after the phone call about notifying you that you have a mass. So what were the next steps after that then?
Right. So my doctor referred me to a urologist. And again, this is at the time where COVID's kind of lifting, but the hospitals are still very strict. My family is on the other side of the border. And at the time, you couldn't come up without a PCR test. So here I am, alone, single. My family, like my parents, my mom's a nurse practitioner. I wanted her with me so much. But there was all these hoops to jump through just to come into Canada. The day of my cystoscopy, I went to the hospital alone and went in not knowing what was going to happen. And I lay on the table, and, the doctor is very kind and very patient. And he says, like, we take a camera and we go up through your urethra and we kind of take a look around with that. And we can kind of get a better idea of the size of this mass that has shown up on your ultrasound. So that's what we did. And I like to tell this story because I hope that people don't go alone to these appointments if they can help it, because they go up through my urethra with this camera, and I'm laying on the table and there's a screen next to me, and he turns the screen over and he says, okay, I want you to look at your bladder. And inside of your bladder, it looks like this like porcelain white bowl on the inside. And he pans over and there's this like sea creature looking thing, is what I can describe it. It's like almost like a flower. And it's just kind of like, because your bladder's full of saline, it's like moving with the saline inside. And he's like, and this is the mass. And on the screen, it looks like, 10 feet long. I mean, I don't even know the actual size of it. It was teeny, teeny, tiny, I'm sure. But you see this And it's like, oh my gosh, this is inside me. After you see your beautiful bladder wall that's perfect, and then you come across this anomaly that's in there. And again, your mind goes into spiral. And this is his day job. Like, this is what this urologist does all day, every single day. But this is my first time seeing inside of my bladder. And this is my first time going through something terrifying like this. So I get up off the table because I mean, there's patient after patient. And I turn back around. I'm like, I don't, what is this? Like, I don't, he didn't give me much information at that moment. And he's like, this is a tumor. And he's like, but we are going to take good care of you. And I remember like leaving and getting changed and just calling my mom and just immediately breaking down into a pile of tears and having a panic attack in the middle of this hospital. I couldn't find my way out because I was so hyperventilative and terrified. And all these thoughts again are running through my brain because now I've seen it. Now it's real. Like when they tell you over the phone, like you have a mass, it's like, okay, well, I can't see it, touch it, taste it. You know, you don't have that tangible evidence. And so when you actually see it, it puts it into perspective that like, oh my gosh, this is real. And so I went into an absolute panic. My girlfriend worked at the hospital and I called her and I said, I can't figure out how to get out of here. And she immediately found me and walked me outside. But it was heavy. It was very heavy.
And somebody who suffers from anxiety, I can imagine that just completely exacerbated your anxiety. Was there
Yeah.
a certain technique or tools that you used to help your anxiety with this diagnosis?
Yeah. So the 4 years previous to this diagnosis were the roughest 4 years of my entire adulthood. And this was kind of the last thing that happened to me, which was the cherry on top. And when I was finally diagnosed, him saying it was cancer, it was like, oh, okay, because at this point, I've had so many bad things happen to me. It's like, of course, this is cancer. So over those 4 years, I just learned how to regulate my emotions through a lot of meditation and yoga and outdoor activity and moving my body. Because for me, moving my body helps clear my mind. And so through this, that was still very prominent for me. It's like, okay, this is what has happened. I have to like move my body to help not get inside of my head and make this bigger than it could be. I mean, it's huge, obviously, don't get me wrong, but you know, we can take these things and make them something they're not. Because at this point, I didn't know what it was. Like we knew it was a tumor, but we didn't know what stage or, you know, any of that at the time.
And you were saying that your family was all in the States. You know, how did they react when you told them about this tumor that you've got and you haven't been fully diagnosed with the cancer part of it, but you know that you've got this tumor?
So, with my mom being a nurse practitioner, our family grew up in a household that we were used to her talking with medical terminology. So, for me, discussing it with her was much different than discussing it with my dad. My dad obviously took it incredibly hard. His daughter, that he doesn't want anything ever to happen to, has this. You know, my mom put on her medical hat and she thought, okay, this is the route we're going. You know, but it is difficult, you know, to see a family member go through something like that, especially if you can't relate to them. You know, that was for me, I wouldn't say it's the hardest part, but not being able to convey my feelings for them to understand in a way because they've never been in that position before.
Right.
You know, they may have experienced that with the loss of a parent to cancer or a friend, but, you know, themselves, they haven't. So that was hard, but they were incredibly supportive. And not once did they ever make it feel like it wasn't something I couldn't get through. You know, they kept reminding me, look at the last 4 years, you've made it through there. If you can make it through there, you can make it through this.
We always think that, you know, our grandparents or parents are the ones who are at risk of being diagnosed with cancer. I don't think that most families really consider their, you know, their child being diagnosed with cancer. I can imagine that was extremely hard for them. Walk me through what the next steps were.
So my cystoscopy was in November, and then my surgery, we weren't even going to go and biopsy it. He's just like, we're going to go and we're going to take it out. It's TURBT, TURBT, and that's what I had done, which sometimes they'll go in and take a biopsy to determine the stage, but we were just going to go in and take it straight out. So I had my cystoscopy to see it in November. And then I had to go through the holidays, like a month and a half, 2 months until my surgery, which was booked for January. That was really hard because you're sitting there in a time where you're supposed to be celebrating with family and friends, and you have this thing inside of you, and you don't know if it's getting bigger. You don't know what it's doing because you can't see it.
And your imagination, I'm sure, is running wild.
Oh yeah. And like I want to be happy, but I'm also terrified because A, like surgery in itself is scary. Going under anesthesia is scary. And now they're going under anesthesia and taking something out of you to now determine what the next steps are. And that's scary. So in January, we went in and I had it removed. And 2 weeks later, after pathology came back, it was low grade, non muscle invasive bladder cancer, which is the best case scenario. So it's very low grade, but bladder cancer has a high risk of returning.
That must have been extremely scary to hear that.
Yeah, it was. And it's funny at the time, at this point in January, after I had it removed and I had kind of a few weeks to sit with it, it was like, well, it's going to be what it's going to be. We have found it, we've removed it, and now we're going to find out what it is and we're going to go from there. So it was honestly just kind of going day by day, right? Because if you spiral ahead of yourself, that's more detrimental to your mental health than anything. So trying to sit with it, which is hard. It's so hard, but I think that's really what kept me going is like, okay, today is today, and then tomorrow is tomorrow, and it's going to be what it's going to be either way.
And so after you had the tumor removed, what was your next course of treatment then?
I luckily didn't have to have any BCG treatments, which is most common, especially for reoccurring bladder cancer. And I haven't since. So for me, it was the removal. And then I was going every 3 months for a cystoscopy. And then we moved it to every 6 months. And now I'm on an every 6 months for the next 3 years to make sure that it hasn't come back. Like I said, it is one of the cancers that has the highest risk of returning. But now it's just kind of like maintenance. It's like going to get your oil changed. Like you go in, we do the sweep. Okay, it's not back. Off you go. Mm-hmm. And I would rather that than tuck my head in the sand and not know what's going on and then have it become something. I mean, like if I hadn't been proactive and gone to the doctor when I first saw the blood, like what could have it been? Where could I have been? How long was it even there to begin with? And like if I had waited another year, where would have it had gotten to?
Right. Well, I commend you for taking control of your own health and being your own advocate and getting answers, because like you said, there are a lot of people that would bury their head in the sand and say, you know what, it'll go away. Maybe because we're women, you could excuse it as some kind of a menstrual anomaly, but good for you for going and getting that medical attention. I'm sure it saved your life.
Oh, it absolutely did. And that's why I'm an advocate now, is because it's so easy for us to say, I don't want to know it, because the C word is such a scary word. You've heard it. I mean, we all know someone that has been affected by cancer, every single one of us. The C word is terrifying. So we don't want to experience that. So of course we're going to tuck our head. We don't want to be another cancer patient. And so it's so easy for us to say, no, out of sight, out of mind. I don't want to acknowledge it, because if I don't acknowledge it, it doesn't exist.
Right. And
but then you're putting
36 years old. I mean, that's so easy to do and say, I think I'm being over dramatic or I'm being a hypochondriac, because we Google these symptoms and it does show up scary things. Right. So, I think when we see that and we say, well, maybe I'm reading too much into this. At your age, I think, it's so easy to excuse these symptoms as something else, being young.
Absolutely. And I just be over cautious.
Yeah.
Like, it's your life. We have only one time on this earth. Like, why would you hide from that?
Yeah.
Make the best of it. And my whole experience through this entire thing is making lemonade out of it, because there's no other way. I am fortunate to have the diagnosis I did. I am very fortunate, but that's because I acted quickly. And if I could say anything to anybody, it's don't think that you're overreacting. I mean, this is your body. If something's not right, go get it checked. And we know ourselves.
Right.
If there's a new freckle, like what is that? Like you have to pay attention to your body.
Yeah, absolutely. I'm just curious, how did your urologist react to being your age and getting this bladder cancer diagnosis? I'm sure this is something that he or she doesn't see very often.
Exactly. I mean, we went through all the questions. Where did you grow up? I grew up in Utah, not in an area that had extra pollution or pollutants within the water systems that could cause this. I'm not an elderly man. Okay, great. Check that off. I'm 36. Okay. And I don't smoke. I've never smoked. So maybe one cigarette my entire life in my younger years, but never smoked. And those are the most common causes of bladder cancer: smoking, older, males, and then environmental factors. And I have none of those. So his reaction, he was just like perplexed. Like, you don't meet any of the criteria. Like, you don't meet any of the statistics as to why you would have bladder cancer. Why? Who knows? So it's just going to show, if I don't meet the criteria, how many other women, because it's a man's disease, quote unquote, how many women have it and don't know it?
Interesting. And now,
Yeah.
do you have a family history of cancer?
No, and that's the other thing. Like, there's no rhyme or reason. So you go back along, I mean, like that we know of, obviously,
Mm.
but there's no one that we know of that has any history of bladder cancer on either side of my family.
You had your family's support then going through this journey. How did having their support impact your mental health going through this?
For me, family's everything. I'm very close with my family, and not having a spouse, I definitely leaned on them a lot for the support in which they gave. My mom came up for my surgery. She was able to come up and was here with me through that. And that was amazing. And just they they never let me get to myself in my head. And that was huge. You know, my family is also my friend family. Like, I
Yeah.
have chosen family, and they also were incredibly supportive. I don't think that anyone that I have a relationship with took it in a way in which made me feel uncomfortable. You know, everyone was incredibly supportive and bringing meals and helping me and doing all of the things to show me their love. And that mentally, like, you need support. And if there's people in your life that don't give you support, those have to be removed, because you have to focus on getting better and you have to focus on your health. And if someone's bringing you down, that's not someone who's gonna you need in your life, really.
Right. And were you concerned about telling your family and friends and how they would react?
No, I mean, at this point I wasn't concerned. It was what it was. Like, I have bladder cancer. But then, to elaborate on it, like, it's what it is. It's low grade, non-muscle invasive. There's no additional treatments right now, and listing out the facts. But I also think it comes from how I held myself with confidence and grace, and it eased them, because I feel like, for me, I accepted the news a bit easier than maybe they did. So how
Interesting.
I handled it is, they feed off of how my emotions are. Obviously there were tears and I was scared, but how you handle yourself is how people are also going to perceive. If you're confident and, like, this is what's happening and this is what it's going to be, the support was, for me, was a bit different than I think that it could have been.
How did being diagnosed with bladder cancer affect your daily life and overall well-being? Like, what lifestyle changes did you make, if any, and what was the result of your bladder cancer diagnosis and treatments on your lifestyle?
Well, I wasn't ever like a heavy drinker, but definitely I was way more conscious of what was going inside of my body once I heard I had a tumor. So I'm told I have this mass and this tumor, and I don't know that it's cancer yet, but I don't want to drink wine. I don't want to drink more coffee than one cup just to, get me out of the bed in the morning. But only water. And I was already an outdoors person, but I felt like I needed to be more active. I wanted to be outside more often. And my lifestyle choices were, oh my gosh, this could be something incredibly detrimental to my life. And I need to make every moment count now. And so I did. And that's kind of also been my therapy is, being more active and being more conscious of what goes inside of me, and just trying to also mentally be around healthier people, and not healthy as like eating salads, but healthy as in mental health, you
Mhm.
know, people that bring me joy.
Right. Understandable. Did you have any lasting effects from the TURBT that you had? Because you said that you didn't get any other treatments after that, but how
Yeah.
was kind of the first couple of months after that, and how are you doing now after that surgery?
So that was in 2022. And the first few weeks after surgery, it's like it's surgery that's not done from the outside. So you don't have an incision. So it's all about you can't do things that you normally were doing before, like lifting, running, exercising, because it's all internal. So like trying to change your mindset, like I can't lift this, 20-pound box. And the pain after, some people come out with a catheter, and I didn't, so I didn't have to take one home. But sometimes when you do come out of those types of surgeries, you do have to wear a catheter for a few days. But I will say that urinating for the first week was incredibly painful. I dreaded going to the toilet, but you are told to drink so much water during that time. And it was just this incredible painful burning, but it only lasted about a week and a half to 2 weeks. And then it slowly went away. But it was, I mean, the surgery's done through your urethra. So, of course, there's going to be trauma. So, you're going to have pain. And then after that, honestly, because it was such, I don't want to say an easy surgery, but it was like I don't have a neobladder or a urostomy bag. So for me, life didn't go back to normal, but it did,
Okay.
right?
Yeah.
Things were a bit different just in my mental, like mentally, it was a bit different. But
Mhm.
physically, it was just like easing back into day-to-day routines, but not having an incision on the outside to remind me that I've had a surgery.
So the role of the healthcare providers is crucial in anyone's cancer journey. How would you describe your interactions with your oncology medical team, and what made those interactions positive or negative?
So I didn't actually have an oncology team, but my urologist himself was just very patient and kind and soft-spoken and calm. And, it's that's important, is to have someone who can answer all of your questions, especially someone who's never been through anything health related before. That's scary. And I had so many questions, and having the accessibility to ask those questions, opening the door for me to say, once you leave this office space, if you have additional questions, let me know.
That's wonderful that you had that great urologist. There's a lot of great urologists that we have in Canada.
Yeah.
And what strategies or coping mechanisms did you find most helpful during and after your diagnosis and treatments?
Do not Google. No one put your phones down. Stop Googling anything. That is something that was instilled by my mom for a long time.
Yeah.
Don't Google, because if you Google, I have a stuffy nose, all of a sudden you've got a brain tumor, So it's like Google can tell you a lot of informative things, but don't Google. Reach out to organizations or urologists for actual informational sheets that is pertaining to your situation. And that in itself was helpful. I mean, I went to my urologist and he gave me, a pamphlet of like, this is what we do during your surgery. And for me, I'm a visual learner. I like to see and I like to understand like what I'm walking into.
Mhm.
And so for me, it was helpful because I was able to read up on this knowledge of like, I don't know, I don't even know what a cystoscopy was when my doctor said it. I was like, I have no idea what that is, but okay, we're going to go do it. But when after that was done and we were going for my actual surgery, he gave me the booklet, and that was wonderful. And I've been working with a couple of organizations who are creating these beautiful pamphlets for bladder cancer patients that go from like symptoms from cystoscopy all the way to, surgery. And that is something that I had that from my urologist, but the more in depth from organizations that's more, we're here to support you, because his information was just like, this is what we do because it's
Very
medical, right?
critical, yes.
But organizations are here like, we want to inform you, but we also want you to feel, I don't know, it's kind of softer. It's provided in a softer way, if that makes sense.
Right. And so how did you find Bladder Cancer Canada?
So I I went on to Instagram. I'm not a Facebook follower. So I was on Instagram and I was like, I want to follow some bladder cancer organizations because I have bladder cancer and I want to connect with an organization where they can put out information and I can read up on it and relate to. And so I started following them. And I did a podcast with them a few years ago, kind of right after my surgery. And what sparked it was I made a comment on one of their posts because they were outlining the most common people that get bladder cancer. And it's the smokers, the elderly, and, pollutants and whatnot, and the men. And I made a comment like, raise my hand, like, what about us women? Like, don't forget about us. Like, what about us young women that still can get it?
Yeah.
And then another gal commented on top of mine saying like, yeah, me too. And then that kind of like sparked this like, oh my gosh, there's like young women diagnosed with this. Like obviously they were aware of that, but we kind of took this ball and went rolling with it because yes, obviously like we need to spread the word about these people, but like what about us that have not, we don't meet any of that criteria, like we still exist. And so that's been incredible with them because they've then since started posting more, about women, and then they turned their Bladder Cancer Awareness Month that month into women, like only focusing on women because it's not just a man's disease, it's an everybody's disease. Absolutely. It's like saying breast cancer is a woman's disease. Like, yeah, of course it affects women primarily, but men can get breast cancer. Same thing. Yeah. So Instagram really was incredibly helpful. And then from there, I kind of followed a few different worldwide bladder cancer groups and got involved with them as well.
And did you connect with other, patients or survivors? And if so, how did that support network help you?
So the gal that we did a podcast with Bladder Cancer Canada a few years ago, she and I connected, and she's not a bladder cancer survivor, but she is a cancer survivor. And, having her support was amazing. And then I connected with another bladder cancer patient named Angela, and I love her to death. And she is a volunteer with Bladder Cancer Canada. And I got involved with her through the women's support group through BCC. And she and I bonded immediately, and I joined the women's support group with them. And that was helpful because it was women only. So, I've gone to events where it's all men and just you, and you can't really relate to anybody, but you can relate to all these women of all different ages and all different, backgrounds and sizes and different diagnosis. And so that was really helpful, was the women's support group. And then through my podcast that I had done is I had someone keep requesting to follow me on Instagram, and my page is private, and I kept declining it because we always get spam. And finally she reached out to me and messaged me, and she's like, I heard your podcast and I am in the same boat. I'm in England and I have everything you're saying is exactly what I'm going through. And I thought, oh my gosh, I've reached someone like across the pond. Like that was like the most inspirational moment for me, because it was like I touched somebody from so far away. And if I could just that one person, that's enough for me to know that like what I've done has now impacted somebody else in the benefit. So then we started FaceTiming, and she was going through what I had just gone through. So she'd call and, I'd talk her through like what it was like and kind of supported her through it. And then even after her surgery, like we still message all the time on Instagram, like, oh, I'm going in for my next cystoscopy. I'm so nervous. And, we trying to pump each other up, and it's been beautiful. It's been beautiful to connect with people that go through it, because like I said earlier, your family or anyone that is supportive of you is great, but they haven't been through it. But when you meet someone that actually has, it's so relatable, and you just feel a whole different level of support that way.
What advice would you give to individuals who have been recently diagnosed with bladder cancer, or to their loved ones who are supporting them through this journey?
Reach out to an organization, no matter where you are in the world. There are so many organizations that are there to support you. There's the World Bladder Cancer Patient Coalition, and they have organizations under them in any country that you can reach out to. So no matter where you are, there's always somewhere to reach, which then can direct you to support groups in your area. And there are support groups for patients, but there's support groups for caregivers, and there's support groups for family members of bladder cancer patients. there's so many different levels of support, and urologists can also provide that information, but these are accessible at our fingertips, at 1 a.m. when we can't sleep because our mind is going in circles and circles, and we can go on to Bladder Cancer Canada's website and, find support groups and find information and find links. Or if you're not in Canada, there's so many other organizations across everywhere that have the exact same support systems laid out. And that support group is a Zoom support group. So even if you're, in Ottawa or you're in Vancouver,
Yeah.
they line it up so everyone's together. It may be late on the East Coast and a bit early on the West Coast, but you can all connect and you're all across everywhere. But like I said, and everyone's just different levels of like what they've experienced with bladder cancer, which is also helpful to hear, because you can have the extremes and you can have my level of diagnosis, but we all have bladder cancer, and that's what we relate to.
Right. And so how about now? How are you doing now? And how are you keeping your mental health in check post diagnosis, treatment, and now that it's been a while?
So my urologist gave me the option at the time when I was going every 3 months to move it to every 6 months for my cystoscopy. There's no other way to check for bladder cancer, unfortunately, without that. And I said, no, I'm okay with every 6. And because I have confidence in you. So he gave me the option. Like, if you want to keep going every 3, we can do every 3. But I feel confident enough to go every 6. So for me, it's like once that 6 month comes up, I kind of, I don't get as nervous as I did the first time because I know what to expect now.
Mm-hmm.
But it's still that lingering, like, okay, is it back?
Right.
If I have any weird urinary issues, immediately my mind goes there. But I have to reel it back and, like, okay, you've been here before, and it was extreme before. Like, you had so much blood in your urine, and look where you are now. So it's just kind of keeping myself in kind of this in-between zone of not allowing myself to spiral and think, oh my gosh, like, what could it be? Could it be worse again when I go in? Because it's going to be what it's going to be.
Right.
Like, you can't change it by worrying, but that's just going to upset you mentally. So trying to keep yourself in this in-between.
No, that's great advice. Absolutely great advice. I think the mind is powerful and we can get carried away, and really it's up to us to wrangle in our own thoughts.
Yeah.
Now that you've had the opportunity to look back, is there anything that you would have done differently?
I think I would have, well, not myself done differently, but I wish that the accessibility to what BCC has to offer was more accessible at the time, like provided to me, not accessible. I wish it was like in my urologist's office that I could have grabbed it right then and there when I first had symptoms, rather than, going after I've been diagnosed, then finding out about them. But also, like, I didn't even think it was cancer. But Bladder Cancer Canada still is very supportive, even with people that are in that in between. You don't know if it is, you don't know if it's not. It's that scary that you still want to talk to somebody, and finding a support group maybe to talk to someone about it. So me doing differently, maybe look into it more, but I also didn't think that it could have been cancer at the time, but maybe just more support on the outside other than family and friends that I would have reached out to.
And speaking of support, how do you see your role as a survivor or past patient in raising awareness about bladder cancer or providing support to others facing a similar diagnosis?
Oh, this is my passion in life. This is my passion, is talking about it, because it's healthy to talk about it, but for me, it's talking about it and reaching other people that are going through it. I don't want anyone to feel that they're alone, because they're not. And so for me, reaching out, connecting with people, going to bladder cancer walks, going to events where I can be a voice. And even for those people that don't want to be a voice, like, I want to scream from the, like, if I could get paid for a living to do this, I would, because I want people to listen to their bodies. I want people to know their bodies and not be scared of the outcome of what things can be, and know that there's so much to do in life, even with something so scary. And for me, what I've taken from all of this is, like, life is so short, And if you can impact one life, like I did with the gal across the pond, then to me, that is worth it. That is absolutely worth it.
Wonderful. Well, thank you so much, Krysta, for taking the time to speak
Yeah.
to me and to Bladder Cancer Canada. I'm sure that you've impacted a lot of patients or even people who are a little bit scared of what they're going to hear in the next week or so with getting their test results back. So I do
Mhm.
appreciate you taking the time to speak with me today.
Thank you so much. And to anyone that's going through this, I want to say find a person. Find a person. Go on those Instagram pages and those Facebook pages and those websites and find a support person to help you through this, because honestly, that is going to change everything for you.
Fantastic last words. Thank you.
Thank you.
This concludes Krysta's story. If you or someone you know has been diagnosed with bladder cancer, Bladder Cancer Canada is here to help with support programs, informative resources, and educational sessions. Visit us at bladdercancercanada.org to access these resources and to share your story. Be sure to follow us on X, Facebook, Instagram, and YouTube. We will respond to any messages sent on socials. If you are a bladder cancer patient or a survivor and would like to tell your story on the podcast, please contact us at info@bladdercancercanada.org.